Good morning again to everybody. I'm not sure that we have everybody in the main room now. Yeah, I think we do. So let me welcome you all and then move on to the first plenary session of today, following the breakout sessions meetings. And just really to be sure, to the technical support, are we ready to move on?
Yes, we are.
Okay, thank you. So maybe what we will do then is we will have the report back from the breakout sessions. And I would like to start by calling on Group A that was chaired by Tor. And the rapporteurs were Bernard Botex and Jean Loudorn. I think, Bernard, you will be presenting the outcome of your discussions. So the floor is yours.
Thank you, Maged. At least I will try. I'm trying to share my screen. Just give me a second. Okay, can you see something?
Yes, yes.
Yes.
Just move it to, yeah, that's wonderful.
Okay. So this is the reporting back from Group A. We had quite a lot of discussion going a bit beyond what were the initial questions. So we just tried to capture what was related to the specific question. So the first question, what are the difficulties at the output of the current risk-benefit assessment present to risk manager when issuing dietary advice? The first point is that the current approach are very much looking at single contaminant, single nutrient, and comparing the actual exposure to these contaminants or nutrient to the corresponding DRV health-based guidance value, which is insufficient for the purpose of the production of the dietary advice, simply because we have the example of the fish mandate where you need to integrate various positive substances and various contaminants together. Then the second aspect is that the health outcomes on which the health-based guidance value are based, meaning what is the endpoint, because what is the effect and the population groups that are benefiting or affected of this effect are often hidden, which is something that is important also for the purpose of dietary advice. And the current approach is intended to avoid the risks at all costs, which means you look whether your exposure to a contaminant is below the health-based guidance values, but this hampers the possible of optimization of public health. So there may be some cases where the purpose of the benefit effect for the public health may justify to take a bit more risks, and that's something I will come back to it later. The regional differences and different population groups that are often not necessarily considered and that needs to be considered for the purpose of dietary advice. We are 27 EU member states, so obviously there are some differences to be considered. The weighing of the health-based guidance values against the DRVs in terms of consequence for public health is not straightforward. So again, this is referring to the critical effect that is behind the DRV or the health-based guidance value. How do you decide the comparison of the severity and how do you weight these critical effects one against each other to decide on the dietary advice? And then the issue about the formulating the question. If you just ask for just perform a risk-benefit assessment of fish contaminants versus positive nutrients or positive substances present in fish, this will fail. And the importance of the scenario-based question. So this is my current consumption pattern, and what if I propose this alternative scenario in a broad picture. So not only about, okay, let's increase the amount of fish from X to Z, but integrating also the consequences. So there may be also some reducing the consumption of red meat, for example, or about the source of protein from a vegetal proteins. What you need the whole picture and the scenario-based approach to address the question correctly, and for the risk manager also to be able to give a dietary advice. About the second question, so what scientific input do risk managers need to issue dietary advice? So it was acknowledged that just weighing the risk versus the benefits and draw the line is not fully satisfactory. There was also we need the common metrics for sure, but we need also to move away from the health-based guidance value or the reference values that are looking only at risks or only at benefits. So we need to integrate both of them. And this is coming back that in some of the cases, this implies that you will have to accept risks if to maximize the benefits. So again, this implies looking at the effect and the severities behind the health-based guidance values. And just to know that, okay, working on you may, let's say that to maximize the benefits, you may have to accept some risk, but there are also in parallel some alternative measures that from a risk manager you should consider. Here we are going a bit beyond the remit of EFSA, so there may be some additional measures to consider in parallel to reduce this risk to a minimum, and there was references to reducing the source of some of the contaminants. So here we go more into a One Health approach, let's say. Need for comparable metric to do the integration. So again, when you think about the DRV, there is a need of a better characterization of the DRV and the health-based guidance values, what is behind. And keep in mind that the DRV is not also about benefits, but it also reflects some risks as well. It's intended to address some risks as well, in case of deficiency, for example. Then it was mentioned it would be helpful to harmonize the health-based guidance value for contaminants versus the benefits for nutritional side. And the question whether moving towards the internal dose when it is possible to derive reference value, whether this would help for as a step toward disharmonization, so make comparable approaches for deriving them, let's say, and so use example as a basis for such an approach. And I think that's it. Yeah. I'm just Thor and Jean-Loup, if you want to expand or if I've missed something, feel free to intervene. Thanks.
No, I think it was a fair summary. Thank you.
Thank you, Bernard.
Okay, well, thank you very much, Bernard. Thank you to the Working Group A. Colleagues, what we're going to do is we will have the reports back from all the working groups, and then we will have a long discussion of about 50 minutes. We have time, 50 minutes to discuss all of them together. You may pose questions to individual working groups, or you may pose questions in general, or you may continue the discussion in the larger group. So with that, let me move on then to the breakout group B. that was chaired by Josef Schlatter. And I think, Claudia Cascio, you will be presenting the outcomes of your discussion. So Claudia, please, the floor is yours.
Yes, indeed. Many thanks. I'd like to ask you if you can see the PowerPoint clearly.
We can, but if you can move to presentation mode, yes.
Do you see the slides or do you
Yes,
see the...
thank you very much. We see the slide.
Okay. Okay, thank you. So our group had a very interesting brainstorm session. So we tried to work along the needs, but we also had some side discussions that were also probably also related to the next topics of this scientific colloquium. So I will try to to give you the key highlights of the discussion we had. Okay, so in relation to the first point, so what are the difficulties that the output of the current risk-benefit assessment presents to risk managers? One of the point that emerged was the current inequality of data in terms of both quality and quantity available for risk assessment and benefit assessment. In the meaning that currently more data are available for the risk side, especially there was discussion on the contaminants, and that probably more emphasis should be given to the benefit characterization. So to really deal more with the benefit and the nutrients and so on. This was a discussion that came in several occasions along the entire breakout session. Another point that was raised is that existing measures for both risk and benefit, namely data reference dose and health-based guidance values, are not sufficient. Are only sufficient to elaborate advice for risk managers when risk or benefit clearly overweight the other. While in the intermediate situations, we face a more complex scenario. And in this case, we are in the need of common metrics that would help and facilitate the process. And I think this is the same point that came across also in the previous breakout session as well. We also discussed of the uncertainty as a key issue, and this might differ vastly between risk and benefit, raising the problem on how to transform this into dietary advice. Being a bit more explicit, we discussed the fact that audience needs something concrete as an advice from the risk manager. So how much of fish can I eat per week, or what kind of fish should I eat per week? And in giving this advice, another point and consideration that of course was also highlighted by the previous group, it is that of course there are regional considerations, so different parts of Europe, different type of fish are eaten, and mostly the difference in occurrence of certain nutrients and contaminants in fish, and also the fact that we are facing different population and age groups. I would probably move to the next slide. Yes. On top of that, other considerations were made by the group that was actually quite multidisciplinary and heterogeneous. So a lot of things came into the game during the discussion. It was praised that, of course, different types of risk-benefit assessment exist. One could be simply weighting risks versus benefit, while, as also mentioned earlier, other types could look at what is the impact of substituting one food by another in the diet, and this might solve different questions, my answer to different questions of the risk managers. One proposal that was discussed is to use results from double-blind interventional studies to help risk-benefit assessment. However, this can be done only for few foods, so this need a sort of prioritization beforehand. How can this be done? And moreover, this would have, of course, a long time scale. So is the risk manager willing to wait 5 or 10 years time in order to have an answer? It was also discussed that maybe weight of evidence consideration could help in setting priorities in the foods to be studied under risk-benefit, in the risk-benefit assessments. And later, there was also, there was quite an ongoing discussion about the value of nutritional epidemiology and assessing relative risks of certain foods and complementing this with mechanistic understanding in order to establish causality. Furthermore, we discussed about the fact that biological plausibility is a key in risk-benefit characterization. And last but not least, there was also a discussion that came again many times that was quoted a few times, that the fact that risk-benefit assessment we cannot ignore the ongoing discussion on mixture assessment, and that in the future the two might find a way to complement each other and to talk to each other, and that this we should be probably putting this into perspective in order to help risk managers in a better understanding of the two components. And I would now probably invite Joseph to complement this report if he wants, if it is the case.
Thank you, Claudia. I think you covered most of the points, and of course is a broad discussion, and we will come back to certain items later on, I think. But for the moment, I think it's fine.
Thank you.
Okay, thank you very much, Claudia and Joseph. Thanks for, it's been a rich discussion. What I can see, by the way, from the discussions in both groups is that, of course, given the broad expertise, the focus of the question went beyond the initial focus, which is on the needs of the risk managers. But I think it's important, to start with this discussion because, the next two sessions will be, on the methodology and on the data, so we can actually benefit from the discussion that the groups had so far. Okay, now let's move now to the third group, and that is Group C, that was chaired by Dominic Turk, and Hermolaus Riveris is the rapporteur. So Hermolaus, over to you.
Thank you. Can you please confirm that you can see my screen?
We can, thank you.
Thank you. So in the Group C, we also collected feedback on several aspects regarding the needs of the risk managers. So initially, we defined that risk-benefit assessment is to be used by risk managers both at EU but also at national level, and that the risk-benefit tools and methodologies need to be flexible, interoperable, and also able to provide simple and useful both for risk managers but also for consumers and quick outcomes. We identified that risk-benefit assessment methodologies should enable the use of national data in order to enable later country-specific outcomes. We touched upon the question, do we need qualitative, semi-quantitative, or quantitative risk-benefit assessments? It was discussed that risk managers usually know what is good and what is bad in general, but they need quantitative results in order to proceed with quantitative dietary recommendations. For example, how many grams of fish is recommended to be consumed. and such aspects should be specified by the terms of reference. The level of risk-benefit assessment details to be communicated from risk assessors to risk managers should be high and extensive in order to facilitate tailored dietary advice. And in this area we should consider specific population groups, specific ages, sex, countries, regions, consumption patterns, specific types of food, and also substitution scenarios. Then we discussed about the communication between risk assessors and risk managers during a risk-benefit assessment exercise. It was discussed that this communication should be continuous, intensified, and that this communication is needed to be more extensive when we compare it to a risk assessment exercise. The communication between risk assessors and risk managers should be used in order to set specific terms of reference and also fine-tune the terms of reference during the risk-benefit assessment exercise, because in some cases there are some burdens or some specific needs identified during the assessment. Still, the scientific part of risk-benefit assessment should be kept independent from the risk managers. Then the idea to establish specific risk-benefit assessment units in the regulatory bodies was also expressed, and we were also informed that this is already a practice in some of the member states. The collaboration among cross-cutting units should be enhanced towards doing a risk-benefit assessment. And because for risk-benefit assessment, we know that a multidisciplinary scientific expertise is needed. Then we touched upon social science and science communication, and it was discussed that it would be beneficial to integrate those two areas from the beginning of the risk-benefit assessment into the RBA exercise, because this would enable to translate both complex methodologies, but also outcomes into simple messages to be conveyed both to the risk managers, but also to consumers. And also integration of these disciplines would enable to understand how to make better use of the results produced during a risk-benefit assessment exercise. And this expertise should be the link between risk managers and risk assessors. Then we discussed that risk-benefit assessment results and exercise need to be able to be integrated in the overall dietary pattern and recommendations for the general population. And also that there is a need to increase preparedness at national level to welcome and to use risk-benefit assessment methodologies and outcomes. We discussed that risk managers do not necessarily need complicated terms and functions. They need to have at the end a clear-cut message, which enables also communicating uncertainties. And it was raised that in cases that outcomes are communicated in a too complex manner, may discourage consumers to take at the end the advice from policymakers and risk managers on board. And at the end, we close the discussion by discussing that a systematic dialogue at the end of this risk-benefit assessment should take place in order to confirm if the risk managers can efficiently use the risk-benefit assessment outcome, or if the risk assessor should go back and look into different directions and different aspects. At this point, I would like to invite Dominique or Claudia or anybody else from the Group C to add anything that could be of relevance. Thank you.
Thank you, Amalos. Nothing from my side. I think you summarized very well and very efficiently our discussions. Thank you again.
Also nothing from my side. Thank you.
Okay, so thank you, Amalos, and thank you also to Dominique and Claudia. with that, we can move to the last breakout session, and that is Group D. That was chaired by Heather Wallace, and the one of the rapporteurs, the main rapporteur, is Jean, who will now present the outcome of the discussions. So, Jean, the floor is yours.
Thank you very much, and good morning again. Can you see my slides?
Not yet. Yeah, now.
Okay, I will go to presentation mode now. Yeah. Okay. So thanks to Heather chairing the breakout session of Group D, and also thanks to Jose, who was helping to take notes from the discussions. Okay, so it is. We had lots of good discussions about the needs, and particularly we were coming to the following, let's say, considerations. In the opinion of the group, it is very important to provide a whole picture and to apply a holistic approach. We all agree that risk managers advice to consumers which would be based on a single contaminant in food doesn't make sense. Risk managers needs to be in a position to translate the scientific advice into dietary advice. And of course, it should be going beyond what we are currently providing in the risk assessments. If you think about what kind of assessments we are now currently doing in the different panels, of course, it would be, let's say, for a risk-benefit assessment of a particular food, we could think of maybe joint opinions on risk benefits, and benefits of a contaminants and a nutrition panel, for instance. But certainly, there was an example provided by Dieter Schrenk, who was talking about, the benefits of chlorination of spin chaining water in assessing risks of perchlorate in food. And of course, if you only focus on perchlorate in food and do a risk assessment, of course, it is the reason for the finding of perchlorate in food is coming from chlorination with spin chaining water. And of course, that has also particular benefits. And that is maybe something that could, let's say, be included in a future risk assessment, that when you're talking about a particular contaminant, that you also, and you come to the conclusion that a particular food, like fish, for instance, is a major source, it could be of benefit to have, in addition to that, also the health outcomes in terms of benefits considered in the final conclusion of a risk assessment. That's what we considered in the group a couple of times. And of course, there is a need to develop an integrated guidance. The integrated guidance, which is taking into account that food is a component in a healthy diet. Full evaluation is needed, whole array of contaminants to be considered together, not one by one. Risk management needs to make use of different scenarios to provide the whole picture. We had some discussion about who's then coming with these different scenarios that we have to consider in a risk-benefit assessment. And I think it is quite clear that it should not come from the assessor. We should have a good interaction between the assessor and the risk manager. And that was also already, let's say, pointed at by previous speakers. I think it is clear that the interaction is important to have, let's say, considered those scenarios which are relevant from a risk management and risk communication point of view. And there was also a suggestion made that an opinion from the nutrition panel on the real benefits of fish consumption, taking into consideration the different benefits, would probably very much help to develop a communication by the risk manager, particularly if the content panel, for instance, in EFSA would have conducted a risk assessment. And as I said earlier, that fish would be an important source. The benefit opinion could then be referred to by the content panel, indicating that let's say, to the risk manager and the consumer, that benefits are also present in terms of consumption of fish. So that is the example where we probably have to look into how can we further integrate benefit issues in the risk assessments or the risk benefit assessments that we have to conduct. Information on the occurrence of nutrients in the fish consumed. It was mentioned a couple of times that it's sometimes limited for doing a risk benefit assessment. So we need information on the occurrence and also on consumption figures for the type of fish that is consumed by the population. There's a big difficulty for the risk manager. We provide, of course, a lot of risk assessments. We are not always balancing the risk assessment with information from the nutritional point of view. We were talking about, well, the current situation, of course, when we are having considerations by the risk managers about maximum levels. Mostly they are based on ALARA principle, as low as reasonably achievable. But of course, we also consider that sometimes these maximum levels are not always protective. The uncertainty assessments that more and more is showing up in all the assessments which the scientific advisory bodies are doing, is sometimes making life of the risk managers more complicated. However, it was considered important that in a particular assessment, that the risk manager understands the impact of the uncertainty on any decision that will be made. Maybe we have to go into broader scenarios in the consideration in risk-benefit assessments. Of course, if you talk about exposure, a European diet doesn't really reflect reality. So we need to think about those scenarios. And again, as what I was previously mentioning, the scenarios should really be considered together with the risk managers. They should come with particular questions. Can you assess these situations which are relevant for us? Because that would be forming the basis for developing dietary advice to the consumers. More information could, on the other hand, also overwhelm the risk managers for considering risk management measures. Therefore, we were coming to a point, maybe a decision tree would be helpful. And this probably would facilitate discussions on the risks and benefits with the risk managers. We need to consider this. It would then even go beyond what we already had in the EFSA guidance of 2010, where it was more procedural, that we have sufficient interactions to come from step 1 to step 2, etc., as was shown by Maggot yesterday in his presentation. Risk managers in the Commission are, and that is of course very fortunate that we have lots of risk managers in the Commission who are experts and understand very well what in the assessment is conducted. The interaction with them leads to more fit for purpose, dedicated and specific terms of reference. And that is of course very useful and also to be expected in the future. We were talking about what Frans Verstraeten was indicating yesterday, that probably there are more of those risk-benefit questions in the pipeline of the Commission and the Member States. So we need to have a look into, let's say, how we can start with a risk-benefit assessment and also taking on board really the needs that we have in the risk management and risk communication area. Regular interaction with risk managers is needed. Was mentioning that we already considered this in meetings of DG Sante's working group on POPs, that we would have a regular interaction with them when we are going to develop the risk-benefit assessment of fish consumption in relation to dioxins and other contaminants. I think this is really, let's say, crucial, or let's say taking the right directions in the assessment. So more making use of interactions between risk assessors, risk managers, and maybe it is indeed what was already indicated in an uncertainty workshop that was happening in November 2021, last year. And this is, of course, the actual situation that we have. Some risk managers want really to have a single number, but others would like to prefer even the consideration of uncertainty that would affect any decision that would be taken. Risk communication, important to understand and know what risk managers would like to communicate. And we were talking about the common elements in the useful risk-benefit assessment. Of course, risks and benefits, how to communicate, providing more and more information that may, of course, sometimes overload the risk managers, but we need to see how we can, let's say, give the main messages that we would like to bring across in the assessments. The scenarios that we were already considering, I think different target populations. We were talking about, indeed, let's say, the possible opportunity to have common consumption metric and health metrics. And there was the report from FAO WHO in 2010, which was making use of this for different contaminants and also for different benefits. That is it. I think if maybe Heather would like to complement what I've been talking about, or Jose.
Thank you, Jean. I think you did a great job in summarising a wide-ranging discussion. And the only thing I would say is that the situation is very complex, and I think we need to find good methodologies for working through this. So thank you very much for your summary.
Thank you, Jim. Nothing from my side.
Okay, thank you.
Okay, so thank you, Jean. Thank you, Jose, and of course Heather. So what we can see is really there are quite a few common elements that came out, and it seems that some of them include the need for having a full picture, a kind of a holistic approach, a clear interaction between risk assessors and risk managers along the way, and should be iterative and continuous. The need for cross-cutting collaboration, for simple, clear messages that really include clear messages about the uncertainty and clear message about how to balance the risks and the benefits. The communication is key. The political acceptability seems to be key at all levels. The need for scenario-based approaches was highlighted with most groups, and this would be done in collaboration with the risk managers. And of course, using the weight of evidence approaches and including information on occurrence and consumption levels for nutrients. And then, of course, and the one thing that is key is common health and consumption matrices. So with that, we can actually move to a general discussion. Actually, what we will be doing is either discussions that, discussion points that you would like to pose to one of the working groups, rapporteurs or chairs, that is possible, or general points that you would like to discuss from the floor. And again, like yesterday, I would like to ask you to, if you have any questions, to put it in the chat, addressed to everyone, and then we will address those, one by one. We will need maybe to prioritize based on, the question that we have, which is the needs, but we will try to address, of course, all the questions. So please, the floor is yours as participants. And if you want to pose a question to one working group, please put in the chat before you put your questions and then put in the person or the working group. So please, I'll give you a bit of time to write your questions. Unless we've satisfied all your needs. So maybe I'll start by asking Amalawas a question about when you said any model we apply, any approach we apply, should allow the use of national data. It's really just for my understanding. So what you're asking for, and your group is asking for, is that, you know, the model could be used either by EFSA at the European level, by others at you know, at maybe even international level, and then that at the national level, risk managers and risk assessors could just include the data, or how do you see that?
Thank you for the question. So indeed, this point was raised because we know that there are differences among populations regarding food consumption, and this has to do with quantities of food consumption, with what they consume, with food consumption patterns, with different combinations of food. So from our discussion, we understood that we needed a tool that enables to, let's say, to incorporate the features that allows to introduce different parameters and change these parameters. For example, a tool that can allow to integrate within data from consumption data from Portugal, and then change it and put consumption data from Italy. But also a tool that enables to change contaminant levels, because levels of contaminations from one can differ from one country to another. So we need something that allows for a harmonized approach, but also at the same time allows for flexibility regarding the input data to give also a more tailored risk-benefit assessment outcome.
Thank you, Amalaus. I think that clarifies it for me. Thank you very much. So I have a couple of questions now. First of all, Dieter Schrenk asks that it says that he did not quite understand how a common metric for risk and benefit could look like. So any one of the working groups would like to address it? Any one of the chairs or the members of the working groups? Can I just prompt Tua if you would like to take a first cut at it?
Yeah, sorry, I mean, wasn't it the DALIs and QUALIs are a form of common metrics, isn't it?
Absolutely. No.
And they have been argued for, I mean, yeah.
Yeah, it's I think Dieter, what we have so far is really the DALIs and the QUALIs, but what we're looking for is there any other possibility? Can we go beyond? So it's really an open question, because this could be the outcome of what we are talking about here. So maybe I can move then to a question that was raised earlier by Ron yesterday, actually. And it was really the question, should we better indicate the subpopulation at risk? In my mind, this was addressed already by a number of the subgroups that said actually that we need to be able to indicate subpopulations, be they at risk, be they actually higher consumption groups. So, but I don't know if any of the working group chairs or rapporteurs or members would like to answer here. Anything beyond? I think it came out as from the what everybody was talking about. Now, here's one question that is interesting. There is a question to Group D, because there was a suggestion that a benefit opinion of NDA would be useful for the risk assessment by other panels. And the question is actually, isn't it contradictory with the general principle of risk-benefit analysis that the work is done at the same time by nutritionists and toxicologists? So can I ask Dieter to clarify, because I think it came from you, this suggestion?
Yes, I'd like to. Thank you, Margit. Yeah, Dominique, maybe misunderstanding. The discussion in our working group was if we had a scientific benefit analysis and an opinion, let's say, an EFSA opinion on the benefits of fish consumption in all details, which type of fish, which group of consumers, and so on and so on. That would be very helpful in two respects. First of all, it would provide the risk managers a good tool to communicate further with the public. Second, it would help us to cite and to refer, in our opinions, to this scientific view. And that's it. We cannot, I think at least, we cannot draw any conclusions in terms of health-based guidance values, things like that. But we can at least mention in our opinions, please look, tell the reader, we do not ignore possible benefits by, let's say, fish consumption. But there is a scientific statement by EFSA covering this issue. Have a look at it. That's it. Thank you.
Okay, thank you, Dieter. And then let's go on to the next question, which is actually more a comment addressing prospective cohort studies. The question is really, since if there is a cohort study on fish and health effects that accounts for both nutrients and contaminants in fish, then oftentimes the problem is that they do not quantify either one in the fish itself. And most often, not even the type of fish is specified. I think it's more of a comment, but maybe someone would like to comment here, maybe Tor again.
I think these studies are extremely helpful. Often they do quantify the types of fish, and sometimes they don't, to the same extent that risk assessment do not necessarily go into the detailed level of fish. But I think as a supporting evidence for risk-benefit assessment or for a risk assessment, these studies are highly valuable because they are a real-life sort of measure of what you could expect to some extent.
Okay, thank you. Josef, I think you want to respond here as well?
Yes, thank you, Maggot. I think the take-home message, at least for me, is actually that the generic risk assessment, risk-benefit assessment is simply not possible, and that there is an urgent need to have close discussions with the risk manager to frame the risk-benefit assessment question as narrow as possible. Because these, in Group A mentioned it and other groups as well, the scenarios are key. I mean, we are talking about fish, but what is fish? What type of fish? Even if you specify the type of fish, that may not give you the final answer, because take the situation of the Baltic herring. Baltic herring is not Baltic herring. It depends where it is caught. If it's caught in the Atlantic and landed somewhere in a specific port, it contains completely different contaminants than when it's caught in the Baltic Sea itself. When the fish is farmed, the nutritional composites may be different. Some of the beneficial compounds may disappear because the feed decides what the composition is. And even the endpoint you are looking at is ambiguous. In our group, we had several times mentioning that we should sort of learning by doing with case examples, and caffeine was mentioned. Here, not even the endpoint you are considering at is clear, because if you think of caffeine putting you in an arousal state, that's beneficial if you want to stay awake. But if you want to put your child to bed, then it's a negative outcome. So the risk-benefit question needs to be framed very precisely to give an answer. And last but not least, yes, also we had a discussion that we need sort of a common metric. But this may also bear difficulties because that may introduce additional uncertainty and actually hide transparency when you come up with a common metrics, because the result from the beneficial side may carry different level of uncertainty compared to the contaminant side. So it's difficult to propose a common metric, and the DALIs and QALYs, I think, have shown this. Thank you.
Yeah, thank you, Joseph. I think actually you mentioned 2 points that were also in several of the questions posed. One is further to the common metrics. We have here a list that Hans Verhaare has provided about possibilities of finding common matrices. But as you rightly said, I think the difficulty is how do we get to the common matrix? And I think what's important is that we do not hide the information behind the approach taken to arrive at a common matrix. So the risk will still remain a risk, the benefit will still remain benefits expressed in scientific terms, but then to compare them, I think we need to get to a common matrix. But that is exactly the difficulty that we'll be facing today and tomorrow, but then of course beyond. The other question that you addressed is the uncertainty, and there have been a lot of discussions here on the uncertainties and what they mean. Because are we talking about the uncertainty around the risks and the benefits, and aren't they different in terms of the way they are assessed and the way they are quantified? So this is a question that maybe one of you would like to address.
I can take that, Magid. I sit
Please,
on the
Heather.
uncertainty cross-cutting group.
Yeah.
So the question was about whether you could address the benefit in the uncertainty section. The uncertainty section is really to provide the risk managers with some information about how certain we are about our conclusions. And we mentioned that we had a workshop on uncertainty for risk managers in November last year, and it became quite clear that different risk managers wanted different information about uncertainty and certainty. So, for example, some risk managers really wanted for us to give them a number like 90% certain that something was in fact a health concern, whereas other risk managers really wanted to have a range of something like 70 to 90% or whatever. So it's really about uncertainty and explaining the amount of uncertainty in each of the conclusions that the risk assessors reach. I think it's probably not an appropriate section to put in the benefits. Whereas if we were to have, as Dieter suggested, a quite separate benefit opinion that we could all refer to at the appropriate times, and that we could refer to in risk assessment opinions, I think that would provide a much better balance. Unfortunately, I think the uncertainty section is becoming more of a full uncertainty analysis, where we're actually going to try to quantify the uncertainties in opinions. So although it's a possibility, I think it's not quite the right section to put in benefits. Thank you.
Yeah, thank you, Heather. So then let's move to another area that was raised, and that is an area that was also mentioned yesterday. If the risk-benefit analysis includes also bioactive substances such as flavonoids, then if you quantify the benefit from that consumption, then you will be adding more uncertainties. And I think this is more of a statement, but I wonder if somebody would like to respond to that. I guess it's pretty clear, so let's leave it at that. And then one issue is when you look at the risk of exposure to certain contaminants versus the risk of deficiency, then we're actually not looking at the benefit on the nutritional side only, but we're looking at risk. So one of the comments said that we call it benefit, but it is actually a risk-risk comparison. And this is something I guess we need to be aware of. So I wonder if anyone would like to add to this. Tor, maybe? I'm putting a lot of pressure on you, Tor.
Sorry, no, sorry, there's a little noise in the background here. No, but I mean, this is a risk benefit, and it has to be acknowledged because it's sometimes that the benefits weigh less than the risks. And I think if we're thinking about it in terms of risk, but it's also about what the dietary reference value mean and what risk does it occur, because the comparability of the health-based guidance value for contaminants and what the dietary reference value are set based on needs to be thought carefully in terms of harmonizing. And if we take a step in that direction in terms of, being able to have two comparable estimates on the same side, I think we will have an easier task of doing risk-benefit or risk-risk assessment.
Okay, thank you, Tor. There is, of course, the open question, and it has certainly a relevance for the risk managers and for the question asked, that when you look at the health endpoints for nutrients and the health endpoints for contaminants, then of course you will see differences, as we've just heard. But then how can you, for example, if you look at sperm quality, neurodevelopmental effects in children and so on, so how can those differences be weighed and communicated? So the question is actually that, does this fit, or is it easy to address in the frame of risk-benefit assessment? It's about, the differences in endpoints and how they can be, let's just say, apples and oranges that will be easy and not easy to compare. Joseph, please.
Thank you, Maggot. Regarding this, it just came up to my mind to ask the question, actually, who should do a risk-benefit assessment? Because in that context, considering endpoints, you may consider also different population subgroups. So how to perform a risk-benefit assessment if one population subgroup is benefiting from a specific food or a component of food, but a completely different part of the population is experiencing the risk. Just as an example, folic acid supplementation of bread, for instance. Of course, pregnant women or those who want to become pregnant would benefit, but maybe elderly men are at risk of getting certain type of cancer. And this is a sort of a societal issue which goes far beyond the remit of EFSA. How to address things like that? Thank you.
Yeah, thank you. So I think there are two things. One is really addressing, the kind of which is called also sometimes equity in risk in risk management, that you're talking about two different population groups, but the example that was mentioned earlier is really in the same subpopulation. I think it came up also in several of the working groups that there is a need, to address different population groups when you talk about risk and benefit, and B, to allow for an application of the approach to different population groups or subpopulation groups, also by local managers. So it's I think it's both. We're dealing really with a very complex matter here. So Joseph, I see your hand is still up. Is it a legacy or?
Sorry for this. Yes,
no worries. No, you could have actually wanted to respond. And Tua, I saw your hand go up and down. So I'm wondering if you wanted to respond here, to add something.
No, I was just thinking, I mean, for many nutrients, you put age-specific or population-specific recommendations, and maybe in risk-benefit, and it's rarely done for contaminants, but I mean, for risk-benefit or risk assessment, this would be one way out of the problem, isn't it? That you could be more proactive in setting population or sort of different recommendation for different populations or regions even.
Thank you, Tor. I have Bernard, you wanted to add something, and then Dieter.
It was just about the previous question on how do we compare apple and pears, so you get different risk associated with different health effects, and how do you decide about the severity? And as part of the DALI quality discussion, and Hans referred to WHO database, if I understood correctly, where there are some weighing factors for severity of diseases that have been published by WHO. And so they tend, when you do this DALI approach, you use the WHO reference. And if the health effect is not in the database, there is a WHO committee set up to decide on the weight to give to this disease. This triggers the question of the kind of international recognition, if everybody is happy to take that as a reference for the purpose of comparison for integrated risk-benefit assessment, of course.
Thank you, Bernard. Dieter, on the same point? Or?
Well, partially. I mean, thank you, Margit. I just wanted to come back a little bit to Josef's question in particular. Who is going to do the risk-benefit comparison, if you like? And I think the risk management has a crucial role here. I don't know if Franz is connected. We discussed this in our working group and in our breakout group. And I think one possibility would be if the risk management comes up with questions to EFSA. Detailed questions or general questions. For example, please, can you outline the benefits of fish in all its details? Or we come up with, as commission, with a precise question: what is the benefit of iodine supplementation towards the risks? Can you provide us a benefit analysis of a certain ingredient, compound, chemical, contaminant, whatever? And that would help, I think, risk management in communicating this, not necessarily in playing around with numbers or with maximum values, things like that, but in communicating the benefits of certain food items to the public. I think that's a prominent role of the EU Commission. And that would also help, let's say, a content panel just to give reference to a scientifically based benefit analysis. Thank you.
Yeah, thank you, Dieter. But you know what we're aiming at is beyond that. I think looking at risk and benefit of, say, a certain nutrient, that is already done. What we're looking for is really a more holistic picture, like we are, as we discussed this morning and we discussed yesterday a lot. Here is a population consuming fish. What is the advice about consumption of fish? Looking at the nutrients and all the benefits that are in fish, and looking at the potential contaminants, actually in the end, all of them, and come up with an advice that could help risk managers reach a final decision. So we will not be, providing the risk managers of the decision, but of a basis, having a scientifically weighed risks and benefits of the whole thing, of the whole complex mixture, if you like, and then they take a decision. So that is the difficulty actually we're fighting with.
Yes, if I may, just briefly,
yeah.
I fully agree, Margit. But I mean, the risks are also, the risk assessment is already provided usually by content panel, so they know about it. What is needed, I think, is that an EFSA expert group, provides the scientific basis for the benefits. And that is not as simple as many people think. Sometimes if you look, and Joseph mentioned this, if you ask the question, how beneficial is fish consumption? That's a very complicated issue. And I think if this is provided in a scientific, very detailed way, that may help. Thank you.
Yeah, thank you, Dieter. I see also that there are quite some discussions or some questions and comments on the metrics, and I think we should, as Diane put it in the chat, we should leave that to the methodology that we'll be discussing this afternoon. If you agree with me, colleagues. Then let me go to Tor first.
But you can also turn the question around, given that you know that there are contaminants in certain food items, such as fish or cereals. What is the consequences of reducing the intake in the general population compared to now? You could also do that as an analysis. You know, we are always stuck with the health-based guidance value and what does it mean, but the alternative question is also valid sometimes. What are the consequences?
Yeah, thank you, Tor. I see also that, you know, the discussion about the benefits and risks and benefits is still ongoing, and it's good to have a hot discussion, even if it's in writing. There is a comment that it is difficult to visualize the concept of benefit analysis because it is a risk versus a risk. I think there is a difference there because it's really about looking at, for example, a nutrient. I mean, that's the one side of the U-shaped curve. If we're looking at a micronutrient, for example, the benefit side. But I'll leave it to Dominique to address that. He's certainly much better at that than me. Dominique, please.
No, I wanted to comment on the benefits, the nutritional benefits. It was already said that it's pretty difficult. So I think there are different steps to be taken into account. One easy step is to make sure that by eating a specific food, the prevalence of the population which will be able to fulfill its nutritional requirements will increase. It's a simple objective, but it should not be neglected. Another objective, which is more complicated, not only to reach, but also to demonstrate, is to make sure that by eating a specific food and a specific amount of this food, you will have a health benefit. In other words, decrease of cardiovascular disease risk or increase of cognitive development in children. So there are different steps to be defined. And I think that it was pointed out by Joseph, and I fully agree with that. The initial scenario asked by the Commission will be key, because if it's a very general question, it's very likely that the opinion will end up with a kind of textbook opinion, very interesting for students, but not that useful for the Commission and the consumers at the end. So really to decrease at least a bit the complexity, the discussion between risk assessors and risk managers at the very beginning of the process, I think is key. And again, going back to the beginning of what I said, to define what is the step the Commission is interested in. Increase the nutritional intake, which is basic, or have a positive impact on health, which is more complicated but maybe more useful for the population.
Thank you, Dominique. I think this is an important point, and we need really to keep it in mind that, and it's also about the communication between risk managers and risk assessors. It's really the issue of problem formulation. The problem needs to be clearly formulated, and the question needs to be clear and focused. If I may, I would like to bring in Franz Verstraete, if you would like to comment here.
Yes, well, I would say indeed, it's a very important that we have indeed very well-defined questions so that we had a good answer. That is very helpful. And indeed, I do fully agree that we have to, in the beginning of the process, have this reiterative process between, indeed, the risk assessor and the risk manager. And as Jean has already referred to, we have already, indeed, this discussion within the working group on POPs, and we will continue this along the way, so to make sure that we can indeed fine-tune, target our question, our needs, and that we then get, of course, an answer that is helpful as well for our regulatory setting of maximum levels, or indeed for the supporting the dietary advice for different vulnerable groups or for the whole population, to be done by member states taking into account their national situation. Thank you.
Yeah, thank you, Franz. Thank you very much. I think this puts it really all into the right perspective. I see that, you know, there is a bit of discussion ongoing on the side about go around these questions, and of course there is a bit of methodological discussion there that, you know, you need a common comparator, you need, you know, so it's, I think we're coming to more or less to an agreement that about certain issues, you know, that need to be addressed, but I haven't seen any further question that address other points that we have not addressed already. So maybe I'll wait a little bit and see if there is agreement with some of the statements made in the chat, but in my view, I mean, there's nothing wrong with having a longer lunch break, colleagues, if you're tired. But let's wait and see if there is any further comment before I try to put together, you know, a short summary of what we discussed.
Maggot, may
Yes,
I
please.
jump in?
Please jump in, yeah.
Maybe one thing which came to my mind is the issue of terminology. Sometimes when looking into the chat, I get the impression that we don't understand the same thing under the term benefit. What is really meant by benefit? What is meant by risk? Sometimes a risk reduction is also perceived as a benefit. And some people are talking about real risk, where you can measure health effects, while others perceive a risk already when it's a theoretical risk. And that has also then an impact on such, not only on the risk or benefit side, but also when comparing them. So I think some clarification might also help framing the question better. Thank you.
Yeah, thank you very much, Joseph. This is really key. I do appreciate that you brought it up, because it's really part of the miscommunication that we're going through sometimes. Dieter, please.
Thank you, Margit. I think, in fact, I agree. That is a key question. We discussed this also in our group, and one idea was to ask the scientific committee to come up with a guidance, just to sort benefits. What are benefits? What type of benefits are there? Are they all equal or not? And how can we approach this question? Thank you.
Yeah. Thank you very much, Dieter. Now, I see actually that we more or less exhausted the discussion. So if you allow me, I'll just try to go through the major points that we discussed. First of all, there was a feeling that we need really not to be too, too sectorial in our approach. We need to look at the full picture. We need to try and appreciate a problem as it is put forward. But there was also a feeling that we need a clear problem formulation, clear questions, and we need to provide clear and distinct and very understandable answers to the risk managers. Based on what was expressed at the very beginning, that the interaction with the risk managers should be along the way, should be iterative, should be continuous, and whenever there is a need for clarification, it needs to be addressed along the way, similar to the existing risk-benefit analysis guidance. The need for simple messages that are clear and understandable was expressed. The need for an approach that balances all of the information that we have and communicates uncertainties in a clear and helpful manner. Communication should not be forgotten. It is still key. It was mentioned in the beginning, and we should not forget that. And of course, the political acceptability at all levels, including the possibility to apply scenarios that are based on national situations to the overall model. There is a lot of discussion on the metrics, but that we will be coming back to tomorrow. And then last but not least, the issue of terminology. And I think the important take-home message from this statement of Joseph, supported by Dieter, is that we will not escape having to have a clear glossary in the guidance, making sure that everybody understands under benefits what we understand, and under risks what we would like to communicate as risk. And again, we appreciate, of course, all of us, that we are dealing with complex questions when we look at issues like fish consumption in general. But we will not escape it, because that is what the consumers would like to know. They want really a full answer, not an answer here, an answer there. And I think we should have learned from the risk communication and perception research that is ongoing following the COVID. Well, it's not even over in the COVID era. So, colleagues, if there are any further comments, reactions, please let me know. And if not, I will take the liberty of breaking early. It gives us 10 more minutes for lunch, and we come back at 2 o'clock. We will be transferred immediately to the breakout groups. So, last opportunity to come up with any further points. If not, thank you all very much. And we'll see you all then, or not all, some of you at 2, and the rest 1.5 hours later. So have a good lunch and see you later. Thank you.
See you later.
Thanks, Margaret.
Yeah.
Thank you.
Hi, Dieter and Thor.
Hi.
You had a good one.
Hi, Jean.
Jean.
Hello.
Hello, everybody.
Hello.
Hi, Joseph.
I have to apologize. I have an exam this afternoon at the university. I'm sorry. I will join you probably tomorrow morning. So,
Okay, Dieter. Thank you.
Thank
you
you for
very much.
Thank you for this morning, Dieter. Much
Thank you.
appreciated.
Thank you for your leadership. Heather and Jean, thank you. It was really great. Okay, I see you later.
Yes, thanks,
See you.
Dieter.
Bye. Dear me.
Is it only me, or do anybody else get a little bit exhausted when this, you know?
It's quite intense, Thor. I remember from both the mixtures and the uncertainty workshop, you are absolutely exhausted by tomorrow lunchtime.
Okay.
Absolutely.
Absolutely exhausted.
Hi, Kunde. Nice to see you.
Hi, Thor.
Hi.
Yeah.
But I think this morning, at least to me, it becomes crystal clear that any guidance, if it's very general, then that will, as it was said in Group A, I think, will fail.
Yeah.
So what is key is really a very concise risk-benefit question to be formulated, which cannot be too broad.
Yes.
Yeah, I think you're right.
But Joseph, what do you do if the question is broad? If risk managers want to know, for example, the issue of fish, what do you do? You know, you can narrow it down, but then the answer is not there that they want.
But there is no single answer of what are the risk-benefit outcome of fish. Then you have at least 20 different things to consider.
Yeah, but if you say, you know, we're considering certain pollutants versus the nutritional benefits,
then
and
we
you
are
look at
back
all the,
to a sectorial assessment and not the global.
I think we also have to look at the consequences, not just the nutrients, because when it comes to diet and you change dietary habits of people, it means different thing in different contexts to some extent.
Yeah.
In our group this morning, it came up also the healthy lifestyle, which diet is just one part.
Yeah.
Margaret?
Yes, Jean?
I think we are live now, so probably we have to start.
Okay, we should
We are.
broaden out.
Okay.
Yeah.
Okay, so I think we will move right away into the breakout groups, right?
Right.
Once we have everybody here. Good afternoon again, colleagues. I think we're ready to start. So I would like to welcome you to the this afternoon's plenary. It's the last activity for today. And what we will be doing is like we've done with the plenary this morning. We will have the reporting back from the plenary session 2, which dealt with the methods. And we will have here first reports from all of the rapporteurs, and then we'll have a plenary discussion to try and come up with some take-home messages on this part. And there again, I will ask you to just write your questions in the chat to everyone, and if you need to address one person in particular, just add at and then mention the person or the working group. The breakout group, sorry. So with that, I would like to call on, maybe we should really change a little bit the order of the reporting. So maybe I will start from the bottom up, so with group D, and see if Jean is ready, just to keep everybody on their toes.
Yes, I'm ready. Okay, so I can share my slides now. Yeah.
Yeah, please do. Yeah.
Okay, can you see it?
We can. Yes, excellent. Thank you.
Okay, thank you, Maggot. And thanks again to the group, and particularly, of course, to the chair and my co-rapporteur, Jose. The chair did very well. So we have 4 slides for you. Maybe it will again, let's say, probably overlap with what the other groups have been discussing, but let's see. So just starting with the methods used, I think it's important that everyone said, well, it is crucial to know from the risk managers for which purpose the risk benefit assessment is needed. Again, of course, this is pointing at the problem formulation and let's say the protocol that we would like to apply in a risk benefit assessment, and of course interaction with the risk manager, and particularly on well, the questions to be addressed in the risk benefit assessment is important. We need to define what we mean with risk and benefit. Again, this is a sort of repetition from this morning that we said we really need to have clarity about the terminology that we're using. And the struggle that we are all having, we may not have all the data. Again, of course, this is something that we have to discuss tomorrow morning. But particularly, we all, let's say, envisage that probably even also if we would have a nice methodology that we really need to have the data, and that this is probably also for the future an issue that we have to deal with, that we have limited data, that we cannot make a full evaluation that we would like ideally to make. What can we do with the data that we have is then, of course, logic. What can we do with what we have? And maybe we were also in that case looking at the limitations that we have ourselves in how we are now conducting, for instance, the usual risk assessments. And hazard characterization, we are really looking at all kind of data, toxicological data, sometimes supplemented with mechanistic data, AOPs or whatever, that could help in completing the picture on the hazards of particular substances. But yeah, of course, we all have to, we are all, let's say, realizing that in risk characterization, we then end up with that health-based guidance value, which is the single figure that we're using. And then we are looking at whether exposures are exceeding that figure, and then maybe even applying different scenarios and looking at different target populations. But maybe we should really reconsider this methodology in the risk characterization, and probably should consider maybe that we are more looking also at particular subpopulations. And of course, it's one of the things that was said by many of the people that we have, of course, always to deal with all these occasional exceedances of health-based guidance values. And sometimes we don't know how that should be considered and interpreted, what kind of risk of disease we can expect. So that's the same as what is now also in this slide. The problem is, of course, how can a risk manager deal with the increasing number of assessments reporting on populations exceeding the health-based guidance values? This is of course also the trigger that we had for the risk-benefit assessment colloquium that we are now in. It was a trigger for the question of the Commission we are, let's say, summing up, one after the other assessment, different contaminants, and still there was consideration that fish is an important source of exposure, and of course then it was leading to the discussion that we are now having together. Common health metrics, I think that it was particularly referred to by Jean-Charles Leblanc, that we have that example of risk-benefit assessment of fish consumption that was done in an FAO WHO report in 2010, where DALYs were used as a common metric based on positive and negative effects on coronary heart disease in the population. So these methods are used in risk-benefit assessments. Also VKM, or Norwegian colleagues, Scientific Committee have looked at different approaches for risk-benefit assessment for fish consumption. It is going to be published quite soon, and our Norwegian colleagues will keep us informed about this. And certainly this will probably be very useful for the work that we will have to do when we are going to address the risk-benefit assessment of fish consumption. And indeed, in that work, also DALYs and QALYs can be used. And they have been looking at different methodologies as well. So are there new methods which go beyond using DALYs and QALYs? WHO was mentioning, Moez Sana was mentioning that they have also been looking at other approaches, qualitative approaches, probabilistic methods to assess different scenarios. But always, let's say, the problem that we have, and that was what I was already saying before, data are currently lacking, and this, of course, will remain a problem to address risk-benefit questions also in the future. Interest in developing new methods, yes, of course, for which type of food and for which type of, for which substances in the different foods. And fish was considered. This is probably an easy example, but if you look at other foods in which we are having the occurrence of particular contaminants and health benefit contaminants, L-Cipufas, of course. Well, that is, of course, something that probably instead of for other foods like than fish, it's probably very difficult to collect all the information that you need, and our knowledge is not going that far. What about DALYs and QALYs? I think that probably you have also been discussing this in the other groups. Of course, it has pros and cons, the DALYs and QALYs. That's quite known. There are limitations and there are opportunities to use them. And of course, it's the common metric that you can use. It has been used a couple of times in studies. But of course, if we really want to do a risk-benefit assessment that is leading to a starting point for risk managers to develop dietary advice, this is probably not very useful. So we should go beyond, and that is indeed the reason that we have this colloquium, that we have to work on an update of the guidance. And there are DALY values also for sometimes health outcomes which have been noted, particularly in the dioxin opinion, when there was a mentioning of the reduced sperm concentration. And probably you can find in some of the WHO global burden of disease studies from 2017, there are probably some informations that you can use for estimating DALYs. Weight of evidence still needed. Maggot was very happy when this was said, and of course we need to weigh all the evidence and we need to integrate the risks and the benefit information that we have available to produce more informative risk-benefit assessments than ending up with DALYs and QALYs. Well, that's what we already said before. So it is also quite important that we are looking at the preparation of guidance documents, which can lead to better understandable language for not only for the risk managers and the public at large, but also for our own risk assessment community. I think it is, we were talking a little bit about one of the examples for which we know that the scientific committee is taking this on board again. It's the guidance on the MOE, the margin of exposure for substances which are both genotoxic and carcinogenic, in which we have that recommendation for the factor of 10,000. and that I can tell you that this was a consideration in the working group of at that time, which was taking them, let's say, 1 year to come to that particular chapter. And in order to have the scientific substantiation of the 10,000 factor that was recommended. But of course, the whole narrative which was built up in that opinion, in that guidance document, is probably not always understood. And it was particularly meant in order to give guidance for prioritization for the risk manager, when the risk manager needs to consider risk management measures. So a lower MOE value would then be of leading to a higher, let's say, priority for these substances which have lower MOE values. And that is, of course, something which is embedded in the guidance, but probably we need to repeat from time to time how to understand this 10,000 factor. Then we had some considerations of what needs to be done in risk-benefit assessments. We were talking about what Frans was indicating yesterday. We will have more risk-benefit questions in the pipeline that will come to EFSA, one of which was breakfast cereals. But of course, we need to be very careful to do such an assessment in isolation, because it is important that you look at it as a component of the whole diet. So not looking at a healthy food, but we should take into consideration this as a component of the healthy diet. And be careful with benefit assessments of particular substances in a specific type of food, but that was let's say, also in the third bullet indicated. We need to look at the safety of food and health together. That was also something that was brought to the attention of the group. I think that we need to realize that our current risk assessments, they are ending up with predictions of, let's say, exceedances, possible exceedances of health-based guidance values. And in those things, we are never making, as a next step, a reality check. Probably we have to reconsider this if it is not needed. Maybe it's outside of the remit of EFSA, but we maybe have to look together with other agencies if we cannot, let's say, do that, because we probably have to move further than ending up with the risk characterization as we are doing it today. But we need to exceed this and look at, can we go and look beyond if we are really, let's say, raising a health concern. And if we can check this, do a reality check in the population, if that incidence, higher incidence of cancers or whatever is indeed occurring in the population. We are not doing that. So maybe this is a consideration for the future. And then we were more or less ending up with the conclusion that methods for risk-benefit assessment can produce the output that is needed by the risk manager. But in future, this may not be good enough. Maybe we need to go beyond. And current methods can answer risk management questions for some specific questions, simple ones. But we really think that new methods are needed for more holistic risk-benefit assessments. This was it, I think. Maybe Heather, Jose, or the group itself has additional comments to make? But this was it, Maggot.
Yeah, thank you. Heather, I think, wants to say something.
Oh, no, I don't want to say anything. I just want to say thank you very much, Jean, for capturing that. It was some challenging discussions and it was great. Thank you very much.
Yeah.
Okay.
Yeah, thank you very much indeed. I was in that group and I can say it was not easy to come up with clear conclusions. But that's how it is, when you have a group of scientists and talking, that's okay. Thank you very much, Jean. We'll move then to group C. And I'll ask Amolaus to give us his presentation of the outcome of the discussion. Please, Amolaus.
Thank you. Can you see my screen?
It's coming now. It is here. Yeah.
Perfect. Thank you. So in the group, we went through the topic. We tried to approach it from different angles. So regarding existing methods used in risk-benefit assessment, and if they produce a scientific output that the risk managers need. So we discussed that focus should not be given on developing new methods, but instead focus should be given on improving the current existing ones regarding, for example, applicability in different scenarios, in using different parameters towards enabling better extrapolation of results. The outcome of the method should include both the numerical values, but also any assumptions and uncertainties present during the risk-benefit assessment exercise. Additionally, any case-specific situations shall be communicated. For example, who is benefited from the scenario and how, who is under risk from the scenario and why. Transparent documentation of steps implemented, of any decision taken, and any assumptions and uncertainties should be performed. Then we discussed about the DALIs, the metric used broadly in the risk-benefit assessment. And the group discussed that despite the limitations, DALIs still offer the possibility to integrate a number of indicators and proceed with the comparisons among different parameters and different scenarios. We discussed if we could use DALIs for biomarkers, for example, for blood pressure, not for a disease. And it was discussed that no methodological reasons exist to exclude such evidence in the risk-benefit assessment methodology. However, it was mentioned that difficulties exist and that adjustments and careful incorporation are needed. Then also we discussed if DALIs are relevant and useful for all population groups, and the outcome of the discussion was that yes, they are. And also we discussed about the use of health-based guidance values and DRVs, and it was discussed that these are still useful as a first step of the risk-benefit assessment, and it's, in some cases can point towards the direction that the risk-benefit assessment exercise should go. Then, trying to reply the second question, if modifications can be made regarding the existing methods that would result in an output needed by the risk managers. We discussed if sustainability can be introduced in the risk-benefit assessment exercise, both sustainability regarding environmental and socioeconomic aspects, and the reply was yes. It was discussed that the current models, risk-benefit assessment models, can be updated to include variables such as price or environmental aspects, and for this, mathematical optimization of the methods would be required, but this is possible. And then we talked about that we need to improve some specific steps in the current methods. For example, how to rank, prioritize, and select components which are to be included in the risk-benefit assessment exercise, and this towards reducing the variability of experts' opinions, to provide a documented approach readily to be implemented across different risk-benefit assessment exercise, and also to reduce the time needed to conduct a risk-benefit assessment exercise. Then we also discussed about risk-benefit assessment of all foods. Should we do it for whole foods? Should we do it using targeted food ingredients? And then it was concluded that if there is epidemiological data evidence available for whole foods, then to opt for a whole foods risk-benefit assessment. However, in cases that we don't have enough available evidence, epidemiological evidence, to go for a risk-benefit assessment of a whole food, for example, it could be a novel food or a food that is less studied, then the risk-benefit assessment exercise could target specific components of those foods and in the risk-benefit assessment scenario. In the last, under the last question, we discussed if there were expression of specific genes related to chronic diseases should be included in the risk-benefit assessment methodology, and also if the impact of specific substitution scenarios or dietary patterns or food consumption versus the microbiota should be also methodologically included. And it was concluded that these aspects are indeed interesting, but are not to be integrated in the risk-benefit assessment methodologies in the near future because of some practical limitations. And to conclude, it was discussed that the EFSA risk-benefit assessment guidance of 2010, and more specifically the tiered approach proposed, is still relevant for conducting risk-benefit assessments in present and future. So this is the feedback from Group C. I don't know if somebody would like to add anything.
No, Amoros, it was perfectly done, especially the discussion on DALIs and QALIs, where we got a lot of feedback from our colleagues, and I'm very grateful to them for sharing their experience in risk-benefit assessment. That was really very useful and very much appreciated. But the summary is just perfect, Amoros. Thank you.
Thank you, Dominique.
Okay, thank you, Amanos. Thank you, Dominique. I think it's you approached it indeed from a completely different angle, and it's also important to realize that when we talk about moving beyond DALIs and QALIs, doesn't mean that we throw the baby with the bath. It could mean that we improve on the existing methods. So thank you for bringing that aspect up in your breakout group. Let me move on then to the next group, which is Group B, with Joseph as a chair, and I will ask Claudia Cascio to present. Please, Claudia.
Yes. Can you see?
It's coming. It's not there yet.
Yeah. Can you see it clearly now?
Not yet. Yes, now. Thank you.
Yes. Okay, so we had a very proficient discussion in Group B, and we focus on many different points that I will try to detail now. I wish this presentation is moving to the next slide. Does it? Yes. Okay, we have been already looking at those questions, so let's see what we discussed.
I don't know if everybody sees two gray boxes on top of the slide.
Two gray boxes.
Yes, I'm afraid
Yes,
so.
we do.
It's
Yeah.
Claudia,
Gray
you need to
boxes?
reduce the chat box and the video, exactly.
Is it better now?
It's gone, yeah, thank you.
Thank you. All right, so in relation to the first question, so if do existing methods used for risk-benefit assessment produce the scientific output needed by risk managers? Again, we stress the need to achieve common metrics, and however, we have been discussing of the limitations, we have been touching on the limitation of the existing metrics, namely the DALIs, because we felt that we stressed the concept that they cannot fully address and capture risk manager needs. On top of that, the group has been discussing the fact that those type of metrics are very difficult to be explained to the general population. we also touched on the fact that a reduction of risk, it is a benefit in itself. So the group mentioned that indeed benefit is a synonym of risk reduction and produce the example of reducing the risk of premature death of chronic disease, for instance. We have been discussing the fact that deciding which are the components of interest in a benefit assessment, so which chemicals you are including or no in your benefit assessment, it is a matter of expert judgment, and that probably more transparency for the choice and the inclusion criteria is needed. But however, this should also be complemented by clarity, a better clarity in the question formulation by the risk managers. Yes. Going to the next question, so if shall we do any modification? Can any modification be made to the existing methods? We phrased, there was a discussion if, given that data are not sufficient per se, can the threshold of regulatory concern, margin of exposure, improve risk assessment? We had a long discussion on this, and there have been positive points raised, but also drawbacks. For instance, for the difference between genotoxic and non-genotoxic chemicals, how would you translate a margin of exposure into level of concern? And different margin of safety are conventionally used for different categories of chemicals, such as intentionally added substances to food, non-intentionally, and genotoxic and carcinogenic substances. And last but not least, how to apply such concept to the beneficial side. Another idea that came through was coming from the contaminant experience, dioxin and so on. Can the toxic equivalent factors and potency equivalency factor be used for assessing and quantifying the benefit, creating something like a beneficial equivalency factor? This proposal was positively accepted by the group. However, it was recognized that a large amount of data would be needed to establish such type of factor. So we have been discussing, and also one of the proposal, one of the questions that came into the game is, can AOPs be used to develop potency factors? And if can a unique potency factor developed per compound embrace the variability of effect on different population groups? We have been discussing more, and especially we have been looking at what if we move away from the dailies, and what could we use instead. The group came to the idea that a systematic evaluation and quantification of the weight of evidence for both negative and beneficial health outcome could be used. And of course, the uncertainty should be evaluated and reported and be part of this comparison, and find also, and we should find appropriate ways to communicate such negative and beneficial effects, both in the uncertainty associated to that, both to risk managers and consumers. We came also across the fact that the thought that risk perception change in relation in what we called avoidability. So if there is a food alternative, or if there is a chemical, well, there is a different risk perception in case you're dealing with, in a case when there is a food alternative, or if there is a chemical, we're dealing with a chemical that as a result of background contamination and cannot be, you cannot find a replacement in your diet for that food carrying that contaminant. However, at some point, the group came to the idea that probably different types of risk-benefit assessment could be used in different situations. So for genotoxic and carcinogenic substances, for what we call unavoidable chemicals, or for intentionally added chemicals. And in the last case, ideally, food should be safe by definition, so probably there is no risk, no need for a risk-benefit assessment in that case, because you might simply not add the chemical to the food in case there is a risk. However, this paradigm would be challenged, for instance, by the bioactive substances that might be added to the food. We had also a discussion about the metrics, and there was an insight into the fact that distinction on how to measure risk-benefit, we should have a distinction on how to measure risk and benefit that directly outweigh each other, and different methods could be used for the ones that have different benefit or risk target. And you will see in the next slide that there will be also more comments on this. As a general principle, we agreed on the fact that common metric can be used if risk and benefit affect the same endpoint or system. And therefore, maybe a common metric would be easy to establish in those cases when they are impacting on the same system or endpoint, and this could maybe be the first question to pose on a possible decision tree to deal with the problem. And what if they are not acting, the risk and the benefit are not exerted on the same system? Is it a scientific problem, or is it more a problem of societal acceptance of the risk? We also came into considerations of the environmental impact. Should this also be incorporated into the model for carrying out risk and benefit assessment? As a very last slide that I propose is this. The group came into finally into this proposal that if different scenarios can be used for risk-benefit assessment, they could exploit different methodologies and discriminate between the situation for avoidable risks versus unavoidable risks. And also there could be different scenarios and methodologies for different endpoints and population, in the meaning that different methodologies could be applied if we're dealing with risk and benefit that affect the same endpoint on the very same population, or if we're dealing with endpoints is different, so we have endpoint for the benefit and an endpoint for the risk, but on the same population. Here we give the example of the benefit of fish consumption versus the risk of reduction of fertility, but they're both affecting, for instance, male population. Or the third option is when both endpoint and target population group is different. So benefit, as an example, the benefit of neurodevelopment in young children versus the risk of cardiovascular disease in the elderly. We also came to the idea that when it comes to dealing with this complex situation, probably it would be the case to undertake risk and benefit assessment for each population group independently, and then give, of course, the risk manager the decision of what to do, which action to take in respect to each population group. And last but not least, this multi-criteria analysis, actually we place it here under the risk management and part, but actually came up across all the different questions that we had, that probably it is the time to also consider a multi-criteria analysis that does not only takes into consideration also concepts as sustainability, acceptable risk, feasibility, and effectiveness. And that was my last slide.
Joseph, would you like to add anything?
Joseph, any addition?
I think you did a great job. No, nothing to add. Thank you.
Yeah, it's been actually a very, very nice presentation. Thank you, Claudia, and thank you to the working group. Again, yet another angle at, this working group got to the questions from yet a third different angle, and I think that's good. That's very enriching for the discussion that we will have at the end. It makes the job of the overall rapporteurs difficult, but it's doable. So thank you very much, and we'll have discussions certainly later, and there'll be many questions. So now let's move to the last group, which is actually the first, Group A, and I will ask Bernard Botex to take the floor. Please, Bernard.
Thank you, Maged. Let me share my screen. Okay, can you see the screen? Yeah.
Yes, we can.
Okay. Except that I cannot move. Okay. So for Group A, we started from the definition of the health-based guidance value, and that the observation that usually it is set considering the whole population or the most sensitive subgroup. But when it comes to the risk-benefit assessment of a food, we identified the need to go to more specific population groups like toddlers, infants, women in childbearing age, etc., etc. So we are back to the issue of the importance of a very precise problem formulation and the availability of the data for the groups considered. If you look only at the whole population, you may miss some possible health consequences for specific subgroups that should be kept in mind when you produce the dietary advice. And of course, you can still calculate using a common matrix whether the scenario that you consider will bring an overall benefit for the population in general. But the idea is that to convey to the risk manager the right message, you need to be clear on the risks and benefits for the various population groups. And the issue about where are the priorities or how to weigh the various effects, then we consider there are societal debate or politics and are borderline with the EFSA remit. So the group was, just as it was mentioned by other groups as well, that the common metrics like the existing one like DALIS can be used. But again, it needs to be clarified that it needs to be done at specific population group level, which means demultiplicating the number of risk-benefit assessments you will do, because you will do it for each specific group each time. Otherwise, you lose the polarization of risks and benefits, and you don't have the right info for the risk manager to make the decision. So again, need to report per subpopulation. One big recommendation at EU level, so level considering all countries together, will also have some serious limitations for the more or less the same reason, because we have different consumption patterns, and therefore it should be made clear in the guidance that you need to go to specific member states level. The issue, then the group discussed the issue of data poor chemicals for risk benefit assessment. And this is an issue to be considered, the issue of availability of dietary intake data, but this is more for tomorrow's discussion. Then we spent a bit of time to discuss the fact that the food is a complex mixture of many different compounds, and it will require a multiple chemical approach. And it was reminded that there is a guidance available at EFSA to look at adverse effects together, so just performing some chemical grouping, and then it proposed some methods for prioritization, looking at hazard index versus exposure. And it was questioned whether the same type of approach would not be mirrored for the benefits and be developed for the purpose for the benefits. So just things like dose addition as starting point, unless you have evidence for interaction, for example. And this would be quite helpful for the purpose of the risk-benefit assessment, and it would also simplify it to some extent, since you move to many compounds to consider to a smaller number of groups that would be subject then for your risk-benefit assessment. About the question whether modification should be made to existing methods so that you get a more useful output for the risk manager. So we mentioned some of them already previously. So go to specific population groups and specific country risk-benefit assessment. Also, to be more transparent and exhaustive on the identification and description of the pairs, hazard, nutrient, and public health effect, because that will help to decide on which to be used and an eventual ranking, which will be done again by an extensive dialogue between the risk assessor and the risk manager on the criteria to be considered. Move away from the compounds approach to consider the food and the food pattern instead. And the difficulty is related to the type of evidence that are needed for that, because it's about observational studies. More holistic approach, integrating the whole bunch of compounds. So look at the food again instead of the substances. Then it was noted that EFSA over the years has accumulated, but also the EFSA partners, that they have accumulated a lot of data regarding risks and benefit assessment for various compounds, and for some foods that have been particular, for compounds that are quite specific for some foods, it could be possible to make a profile of the main risks and benefits associated with those foods. So just kind of an input for a food pattern approach for future risk-benefit assessments. The need in the guidance to be transparent about the assumptions done or to be made behind the metrics that are used. So this is linked with the previous discussion on uncertainty. And I already mentioned the issue of data poor compounds. So how is the DALI quality or this single metrics approach applicable for those and suitable for those data poor compounds, to be clarified. As it was mentioned, there is no the current approach described in the current guidance for risk benefit assessment remains applicable to some extent. So it's not always needed, as mentioned, to go to the single metrics approach. So that's the case where risk overwhelm the benefits or vice versa. One thing that was eventually discussed is the possibility to compile the various approach. So the common metrics approach, where you look at the food in general and try to come with the optimal scenario, and then next to it to use the single compounds or the reference value approach, which will be particularly useful when the optimal approach results in exceeding an health-based guidance value from one of the contaminants, because then this is something extremely relevant to flag for the knowledge of the risk managers for considering next to the optimal scenario if there are also parallel approaches to reduce the risk associated or to reduce the effect associated with this exceedance of the health-based guidance value. If not already done, an obvious recommendation is to review the available common metrics that are existed and that could be used for the risk-benefit assessment, identifying the strengths and limitations and what are the assumptions made behind those metrics. Then there are also a number of alternative evidence like observational studies, in vitro, NAMs, molecular data, molecular approaches that are usually not taken into account in risk-benefit assessment. And these alternative evidence, they give information often on the relationship between the food and the health outcome in the population, which are quite important for the risk-benefit assessment. So it's about the integration of the consideration of those alternative evidence in the future guidance for risk-benefit assessment. Then progress has been made since the last guidance with the development of a number of methodological guidance that are useful to be considered for the update of the guidance on RBA, like biological relevance, weight of evidence, Prometheus incorporation of benchmark dose, so to be considered for a future update. And that's it. Thor, Jean-Loup, did I miss something?
Thank you, Bernard. I think it was a great summary. Thanks a lot. Yeah, it's really crystal clear. I would just like to highlight the second point there on the last slide that we discussed a little bit. That, I mean, the overall take-home message from this is that we need to be flexible, and when we set health-based guidance values or dietary reference values, we usually don't look at these studies that look at fish intake and possible adversity, or rodent studies where you feed fish or fish oil or any type of food. I mean, the food it is the food that matters, and we know from randomized controlled trials that when you supplement a nutrient, you can get a completely different answer than compared to the food. And somehow we need to incorporate more evidence into risk-benefit assessment because we are operating on the margins. But yeah.
Thank you very much, Jean-Loup. You didn't have anything to add, right?
Anyway. I think it was a great summary, and yeah. Thank you.
Yeah. Okay. Well, thank you very much. It's yet again, a different approach, but then the answers seem to converge somehow from different angles, and I think it's really a very interesting and rich discussion that we had in the various breakout sessions. So with that, I would like, while I know that everybody's tired, I hope you have still enough energy for a general discussion on the outcome of the breakout session discussions on the second question on the methods. So the floor is yours, and please, as I said earlier, use the chat, and if you want to address somebody in particular, put @ and the name in advance. While you're thinking, I think three things emerged in my mind that were overarching. One is, I think almost every group discussed the need for population-based approaches, moving away from the individual-based to the population-based approaches, which doesn't mean that we change all the methods. It's just for risk-benefit, we need to look at the population and subpopulations. The second one is that the existing methods can be improved. They should not be just gotten rid of, but that in addition to looking at them in terms of their validity, we need also to look at them in terms of recent developments in science. And then finally, I think that the new methodologies, new approaches that have been coming up could actually enrich the discussion. I see that, Diane, you've asked for the floor. As I said, we'd like to have the questions be in the chat, but exceptionally, I will give the floor to you. Please, Diane.
Sorry, I think I said floor, please, before you said that. I was intrigued that both groups A and B referred to combined effects on the beneficial side. I couldn't think of any examples why you might need to do that. Can somebody perhaps come up with an example?
Thanks, Diane. Let's ask groups 1 and 2. Tor or Joseph?
Well, I'm not sure whether what you actually mean. In our group, at least, we didn't talk about combined effect of beneficial effects.
If I may comment?
Please, yeah.
Yes, so one example that we used was that several nutrients will have the same mode of action, such as antioxidants. So many nutrients could work as a network of antioxidants. And in that respect, a relative potency systems like we have for the dioxins could work for the total antioxidant capacity of, for example, the organism. So that was just an idea that that the same system could be developed, perhaps also for nutrients. Thank you.
Yeah. I think this, I would challenge that with the fact that, especially with the antioxidants, they all redox cycle. So they could be also harmful on the one side. And then I don't think you can have an additive effect or even with combined with potency. So it's not as easy as looking at adversity, but of course, with the necessary assumptions, it could be done. But interesting thought. Diane, does that answer your question?
Yes, thank you. That was a good example. Maybe it wasn't Group B. Somebody mentioned beneficial effects factors as an equivalent to TEF. Maybe it was not B, but never mind. I mean, that antioxidants is a good example. Thank you.
Okay, thank you, Diane. Let's see. I don't see any questions in the chat, so I feel tired. Okay, now I see that we are tired of writing, apparently. So I will divert from the initial plan to have only written questions and then take the questions from the floor, because otherwise we will have none. So Katarina, please. Katarina Petitska.
Sorry, yeah, I just want to answer Diane. I think you meant on the question on the factors. So we assess the dioxins factors, and someone in the group said that we should also look at the beneficial parts, so to set not only the equivalent factors for the risks, but also to establish the risk equivalents for the benefits. Am I right, Diane?
That's what I was thinking of. Thank you.
Yeah, I don't remember what was the group, but I remember someone mentioned this indeed.
Yeah, and I think we did. I think with the example that we heard from Robin, I think we've addressed at least the idea of where it was going. Not an easy task, as I said, but it is doable probably with the necessary precautions. So let me see. There are no further questions apparently. Is it because everybody's tired, or is it because the discussions at the breakout sessions were great? Okay. This is an interesting question. When we're looking at the risk side, there is, of course, short-term effects versus long-term effects, and even very long-term effects like bioaccumulation and maybe resulting in cancer. So what it says is even with DALIs, you can only capture a kind of momentary picture of the exposure and not the one over the whole life. Just as a caveat, we're not dealing with acute effects, but maybe from the general point of view, how can we make sure that we are really looking at the long-term effect? Anyone volunteers to respond to that?
Yeah, I could do that shortly, Margaret, if you allow me.
Well, Hans, in principle, it should be one of the
sorry.
But please go ahead. Please go ahead.
And, I recall the RIVM report from 2006, Our Food, Our Health, where they calculated DALIs for short-term effects infections, etc., as well as for that for long-term effects like cancer. I'll give a link to in the chat.
Okay, I think that is helpful for everybody. And but again, as we said, we're really not dealing with the acute effects here. It's really about dietary consumption over a period of time. So let me then go to the next question from Diane, which says that Jean mentioned increasing numbers of exceedances of HBGV, and it's actually more common that this is not really maybe not really a real risk, but it's really because the HBGVs go lower and lower. So I think we'll leave it standing as a statement. And then there is, I think it's also a comment that the distinction between avoidable and unavoidable chemicals is very relevant. And but regardless, when moving to holistic assessments, when you include sustainability and other ideas, you will actually blur the picture, so you will need to address the two. But I think, the initial idea, as far as I understood it, was that we're really dealing with different types of chemicals, those that you can avoid and those that you cannot. But if I say those that you can avoid, then we can go back to the comment by Dieter this morning that adding chemicals may actually be a technical necessity to avoid other risks. So it's really a very difficult picture, but I don't know if any of the chairs or rapporteurs would like to answer here. I think we all agree that's why no one is volunteering to answer, and I think leave it standing as a statement for now. So are there any other points you'd like to raise? I think the one point that I would really like you to discuss is there have been quite a few comments on the fact that maybe we don't need new methodologies or new metrics, but we can use the ones that have been used so far, but improve the background, the database. Is that something that anyone would like to comment on? And given that it's late in the day, I will allow anybody to raise their hands, if you like, if it's easier. Yes. It seems, yeah, Tor, please.
I was just wondering with the discussion on TEFs and more data and the complexity and combined exposure to multiple chemicals and transparency. I mean, in the end, we can hang ourselves in our own methodology to the extent that we will not be able to do a risk-benefit assessment unless it takes years. So the question is also, so how can we, with all these ideas and adaptation of method or new method, whatever you call it, be still flexible enough that we can achieve risk-benefit assessments when needed in finite time? And that is, because some of the things that we are discussing are a little bit top-heavy sometimes.
Yeah. Thank you. So I'm just trying to see if there are any further questions. There is one question to Amolaus. You mentioned that when assessing whole food benefits versus nutrient benefits, that one should look at the whole food unless we don't have whole food information. And your example was that of novel food. So the question is, when you have a novel food dossier which is submitted, are all known risks and benefit of the novel food known, and can they be assessed before having a conclusion? I think it's more than a question to Amolaus. It's really a question to the novel food working group, but Amolaus, you probably know.
So thanks to Katarina for the question. So first of all, in the remit of novel foods, the remit of EFSA, what we assess is the risks. When we do a novel food assessment, we don't assess any potential benefits linked to the consumption of this novel food. So this is let's say, one part of the reply. Then, in the novel foods, for the novel food safety assessment, there is an EFSA guidance, and in this guidance, it describes the body of evidence used to do this assessment and arrive to a conclusion. In this body of evidence, we have, like, of course, compositional data, we have toxicological data, in some cases, human studies, exposure assessment. But when we talk about risk-benefit assessment, and what has been discussed in the group is that in some cases, we don't have dose response studies on humans able to link a health effect to a specific food or to a specific component, and this was identified as one of the limitations when we in this area. So in some cases we can conclude on the risks, but when we talk about the benefits, there are different considerations to be made, and a different body of evidence to be assessed and considered. And currently in EFSA, we do assessment of risk and benefits separately. And maybe you're aware that for the benefit assessment, there is another guidance linked to these assessments, which describes different scientific requirements to perform these assessments linked to potentially beneficial effects.
Yeah.
I don't know if this replies to the question.
Yeah. No, thank you, Amalaus. You've outlined, quite clearly what your thoughts and how you see the full picture. But maybe I can pass on to Sylvia, because Sylvia, you're talking about the EU legislation, so maybe that's important as well to understand.
This is in relation with the question that was addressed to
Yeah.
Hermolaus. So we see that the questions we get that follow European legislation are really scattered on that. So novel food is only about safety, health claims is only about benefit. And we ended up sometimes in the situation of assessing health claims for novel foods that had not cleared the safety assessment yet. But there's no way to put them together. And maybe doing risk-benefit assessments in the area of food could come from there. But the legislation, actually, we are doing that separately because the legislation is like that.
Yeah, yeah. But of course, we can trigger legislation through our parliament members.
Yes.
But that's not the function of this meeting, of course. But thank you very much. There is also a point that Jacob van Klaver has mentioned. Jacob, I will break with the rules and ask you to put your question or your comment yourself, because I'm not clear where you're going with it.
Oh, yes, I just, Hans Verhagen put some old work of RIVM on risk benefit in the chat, and I added an update on that, which was a nice work of my colleagues balancing the risk, benefit, and sustainability of food. And they looked where is the discrepancy, where does it not go nicely together. And in certain areas, you can say the benefits are good and there are no risks. And in other areas, you could say, well, there are risks. And then some food items are of concern. But that work nicely show the triangle between food and food safety, sustainability, and healthy food.
Yeah.
And regarding the questions from the regulators, indeed, but that might change if you look in the farm to fork strategy, where you see a lot of more issues on these aspects. So maybe these are the current questions that you are referring to, but there might be new questions in the area of the farm to fork strategy.
Yeah, thank you very much, Jacob. Would be actually useful if this work can be also shared with the rest, if it's published.
Yeah, I put a reference in the chat, so you can click on that.
Oh, yeah, there it is. Sorry. Yeah, thank you very much. I think that's very useful also for the further work of the working group. So much appreciated. Any further comments here? I think people are getting tired, right? So maybe, yeah, I see that Alberto is mentioning that novel foods could be a priority issue for risk-benefit analysis. Again, depending on the legislation, but I think it is certainly something to look into. And I see no further comments. So maybe what I'll do is I'll ask the overall rapporteur, Luisa, to give us a summary of the conclusions that you heard about the second question, the main points, the points of convergence and diversion, and then we can, if need be, can go back to a discussion. If not, we can call it a day. So please, Luisa.
Can you hear me?
Yeah, no, yes.
Yes?
Now we
Okay.
can. And if you can move to presentation mode will be good.
Yes. So, okay. So bear with me. I hope I got all the points right. So I just tried to put here on the slide the most prominent issues that were discussed and common to all the breakout groups and the discussion. So the idea was to focus on improving current risk-benefit analysis methods, ranking, prioritizing, and selecting the components to be included in the analysis to reduce variability of experts' opinions and also the time needed, and also the need for transparency in the choice of components. Also, again, the clarity on the purpose of the risk-benefit analysis. Again, the problem formulation needs to be as narrow and concise as possible. As Maggot mentioned, first, population-based approaches for this risk-benefit analysis. There was also discussion on the already existing approaches like the DALIs and the QUALIs, noted that they have limitations, but they can integrate indicators and compare parameters and scenarios, but adjustments are needed. Then maybe the last point is more for tomorrow, limited data to do a full evaluation, and also the situation of data poor chemicals was raised. Let me try to go to the next slide. Yeah. Then I here compile some of the ideas that were raised by the various breakout groups on other approaches or ideas to complement what is already existing. There was mention to probabilistic methods to use the margin of exposure, the integration of alternative evidence lines like NAMs and observational studies. There were also proposals to compile various approaches, such as use the common metrics plus also the reference values approach. Weight of evidence, the need to do weight of evidence was made by several groups, and I think it's clear to integrate risks and benefits. Back to this discussion that Diane also raised in the chat about beneficial equivalency factors, whether this would be something to explore also. And there were also proposals for tailored risk-benefit analysis, considering different approaches for genotoxic carcinogenic chemicals, unavoidable chemicals, and intentionally added chemicals, and also proposal for having scenarios for different endpoints and populations, depending whether both the endpoints for the benefits and the risks and the populations coincide or they were different. So these were the notes that I took, and I'm happy to discuss further or to receive additions.
Thank you very much, Louisa. I think you've covered the pertinent points very well. I mean, of course, you cannot repeat what everybody has said, but these are the things that crystallized out in my mind as well. Thank you very much. Are there any comments on this? Are there any points that we missed? It doesn't seem to be the case, and I see also comments saying that it's been a long day, and I agree. It's been a very long day. And I think, everybody participated very nicely. So I think we deserve an early night or an early evening, and just to relax and get ready for the final day. So if there are no further comments, let me thank you all very much for the rich discussion, for the excellent participation, for the good ideas. And I'd like to welcome you tomorrow again. We will start as before with the breakout session, and then we will move to the final plenary session afterwards. Jean, would you like to add something? I see your
really.
face.
I don't want to prolong the meeting again. No. I just wanted to thank you, Maggot, for chairing all these plenary sessions, and certainly also to thank in the background Maria and Luisa, who were taking lots of notes from the plenary sessions. Thank you so much.
Yeah. Thank you, Jean, and yeah, and see you all tomorrow. Have a lovely evening, and have a nice drink to relax, and then we'll see you tomorrow. Bye-bye. Thanks, everybody.
Bye, everybody.
Thank you, Maggot. Bye-bye.
Bye.
Thank you. Bye-bye.
Bye-bye.
Bye, thank you.
Bye-bye.